Hey everyone, I want to give my 3 week update. It's Tuesday, so that means that 3 weeks ago today I had my implants placed. I'm doing a lot better than I was last week, like a lot better. I'm not in any kind of pain now. Occasional discomfort, but no pain. This implant is still tender when I press, and I don't know if that is gonna change as things heal. I'm not sure. But from what my friend in the UK tells me, who also has implants and has had them for a little while now, he says that that's like that the pain that I was feeling sounded like compression pain, and it's like when they put the implant in and it compresses on that bone, which could kind of mess with the nerves. Not like the implant hit a nerve or anything like that, but you get what I'm saying. Basically, it's normal, and as the bone integrates with the implant, things should kind of calm down in there, and all of the discomfort should go away. So I'm looking forward to that, but at least I'm not in any kind of pain. That massive tissue behind my bridge, I figured out what it was, and it did not pop up after the implants were placed. I noticed when I posted my video where I'm showing like all up in my grill and everything that I had that there right after the implants, and I remembered because there was nothing blocking my view. My gum back there kind of changed from my permanent dentures. It's like I know that it sounds weird, like, but check it out. When I got the permanent dentures, they fit really nicely, but it seemed like my gums, like, it seemed like they weren't right behind my two front teeth. They were dipped a little bit more. They were just dipped slightly, and my gums took on like that mold. It took on that shape, and it was very slight, but enough to make a difference. And so I'm just not used to feeling it with a bridge there, because when I run my tongue across there, obviously, before I had no teeth in, and so it didn't feel as alarming. But now that I've got, a flat bridge, like, it stops, like, and, like, so it feels like it's protruding when it's not that much, if that makes sense. I don't know if that makes sense or not. I'm sorry, but it's getting a lot better. It feels like irritated, probably because I keep messing with it, but at least it's going down, and it's not anywhere near as massive feeling as it was before. So that's good news. That, as my palate is exposed, everything should kind of smooth out again, because it's not, crammed in dentures. So that's that. Saliva production is at an all-time high. I don't know. It's crazy. Like, I am just like slobbering like a infant. It's just ridiculous. And I know that's normal. I think that I had this saliva issue for this long when I first got my extractions. And then when I got my permanent dentures, it didn't take as long for that to go away. And now, I don't know. I'm assuming it's normal. I'm pretty sure it's normal. But it is weird because the whole surroundings, like, in my mouth have totally changed. It's totally changed. And so I don't know exactly how to stop that flow, if you know what I mean, because like I'm still getting used to trying to talk with them and eat with them, and it's different. It's just different. And I do have a slight fear of the implants. I'm really nervous that I'm gonna mess them up, and I know that that's probably totally ridiculous, but like, I'm scared that I'm just gonna, like, in my mind, I imagine, like, if I was to try to bite into something, like, that bad boy would just and like break right out, and just like I'd see it laying on the table or something crazy. Totally crazy. Unheard of. That does not happen. But in my mind, it does. So, for any of you who are planning on getting implants, you might have the same little phobia that I do. And you really need to, like, not take it overboard with your implants in the beginning stages anyways. Like, so I wouldn't, definitely wouldn't recommend, like, eating corn on the cob and ribs, and that's like my main thing that I always talk about. I can eat corn on the cob, I can eat ribs. Yeah, anyways, I wouldn't do that in the beginning stages. They recommend that you stick to kind of like, easy foods in the beginning, nothing really crunchy and all of that. And I'm not, but even
It's
like eating
11:30.
cereal, it kind of makes me think I'm gonna mess something up, or I'm worried that I'm gonna get like a pain like I used to get with my teeth, like, that feeling of biting into something and it just sends that shock wave through your mouth. Like, I'm scared that I'm going to experience that, so I don't even try. I'm sure I'll feel much better when I can get back to Dr. Golpa's office and have him, like, inspect it and reassure me that everything is healing appropriately and everything looks normal, because I'm just a worrier, honestly. So, that's that. I'm doing a lot better, though. I'm doing a lot better, and nothing's loose. Nothing's loose. I think I said in my last video that I thought something might be loose. It's not loose. I just, it has that effect because there is a slight space between the bridge and my gums, so whenever air pushes through there, it gives the feeling that something's wiggling when it's really not. So everything is very, wow, very much in there. I'm just not used to that air traveling, from back here through, because, that doesn't really happen with dentures. Well, at least it didn't with mine. And then, on the top, saliva traveling through still drooling occasionally, so whatever. But I'm sure all of that's going to be settling down here very shortly. Talking, I'm still kind of talking with a little bit of a lisp. It's still there, and I could sit here and I could try to come up with an idea as to why I'm talking with a lisp, but I just don't know. I don't know. Then, appearance. I am absolutely in love with the top teeth, the placement, how they look. They're placed just like, oh, perfect. They are so perfect. I love them. If after looking at my video in Vegas when I was in the car, the first video, when I was riding in the car on the way to the office, you could see how much they protruded. And it's not that that looked bad, but it looks better. It looks more natural. Like, that looked, like a little bit much. And when you first look at yourself after you get new dentures or bridges or whatever, you're not gonna, in some situations, like if your teeth are just bucked way out, you're gonna be like, they're bucked, but there's subtler things where you can look and you could say something's off. I'm not totally sure what that something is. I can pinpoint a few things, but something looks different. It takes a little time to really understand what you're seeing that's not quite looking right. And I figured out that the top seems very much normal. The top and how my lip is supported up top, that seems normal. It is just the bottom. It's just the bottom. And as others have suggested, who also saw what I was seeing, the bottom teeth, since I not only lost so much bone in the beginning, but he had to remove a little bit more to level it out again. And then his concern was, Dr. Golpa is who I'm talking about, his concern was that he didn't want to see too much teeth bottom teeth when I talk, because that's not natural to see a whole bunch of, like, your bottom teeth, to see, them as much. I think that they could stand to be slightly higher. Slightly higher. But the big issue is that they need to come up more and out more to fill that in. You see how that dips? It needs to be bulked up there. So that's what needs to happen there in order to give me my natural appearance again, how I looked before. If you've ever had your dentures in, like your top denture in, but left the bottom out, and you see how the bottom kind of caves in, that's kind of what this is doing, but not as bad, because there's at least something there. It's just not enough support to support that area because of the bone loss, so that's the main thing that needs to be corrected. And then, the other issues still that I mentioned in the last video. But, with all of that, with me seeing things that were off and not being able to totally tell what it was, I didn't tell you guys how much I appreciate the teeth. They're beautiful. I mean, the shape and everything, the shape, the size, the way that they are laid out, the canines come down slightly more. I mean, they are gorgeous. They're really, really pretty. I like them a lot more than my dentures, honestly. My dentures were a little bit too prominent. So I love these teeth. Love them. And cleaning them is getting a lot easier. The water pick setting, I was able to move up to like a 6 now, whereas level 2 was like, oh my god, how am I ever going to use this in the beginning? That's gotten a lot better. There's still some flaps of skin that seems like it's like covering my bridge, so it's hard to get up under there, but it's still the adjustment period. It's still the healing period. I'm sure everything will settle down and that'll get much easier. But I love cleaning my teeth. And for those of you who don't know, like, these don't come out. They don't come out. I don't take them out. The dentist can take them out. He can use his little tool and he can take them out, but I can't take them out. So they're not snap-in dentures or anything like that. So that's why I'm really concerned about keeping them very clean, because the last thing I want is like halitosis from like food particles lodged up under there for like a month or something, so I clean my teeth after every meal. I have not eaten out yet, but I think when I do, I think the most appropriate thing to do would be to carry a travel size of Listerine, because it seems that Listerine like really gets things out of there. And I'm gonna have to do a video on cleaning my teeth, showing you guys me cleaning the bridges and everything like that, like the process that I use to clean them. But whatever I don't get with the toothbrush and with the water pick, Listerine going up under them bridges, and it's a certain way that I do it, it just removes everything, and it's so fresh feeling, and I love it. I love it, love it, love it. I love being able to clean my mouth like that now. Like brushing my teeth with a toothbrush normal, not having to take anything out. I love that. So that's my update for now. I am really starting to love things, and I'm even more optimistic of how this is all going to pan out for me. So I just wanted to give that update, especially since it's so much more positive than last week. So you guys look out for the next Vegas video. I'm going to try to get it up tomorrow. If not tomorrow, definitely Thursday, because I've already made it. I just got to change a few things. So I hope everybody's doing well, and you guys take care.